What's up? I'm Dr. Jonathan, and today we're diving into respiratory diseases and disorders. I've created a quiz and learn challenge focused on clinical reasoning. Grab your notes app. Active participation is key. We'll tackle 40 essential questions, each with a rationale to boost your understanding. This is your chance to test your knowledge and sharpen your skills. Ready to see how you stack up? Let's get started. A 68-year-old smoker has a chronic productive cough. Most likely diagnosis: A. Asthma. B. Chronic bronchitis. C. Pneumonia. D. Lung cancer. The answer is B. Chronic bronchitis, defined by a productive cough with smoking as a major risk factor. When prescribing an inhaled corticosteroid for an 80-year-old with asthma, what prevents local side effects? A. Use a spacer device. B. Take with water. The answer is A. Use a spacer device. What's the gold standard for diagnosing COPD? A. Chest X-ray. B. ABG. C. Spirometry. The answer is C. Spirometry. What's the most significant risk factor for pneumonia in older adults? The answer is aspiration, often due to impaired swallowing. Decreased FEV1, decreased FVC, normal FEV1/FVC ratio. Obstructive, restrictive, or normal? The answer is restrictive lung disease. Both values drop proportionally. For healthcare workers, what TST induration is considered positive? The answer is 10 mm or more. Medium risk groups use this cutoff. A 45-year-old non-smoker has a 5-day cough after a cold. Best management: A. Amoxicillin. B. Chest X-ray. C. Symptomatic treatment. D. Oseltamivir. The answer is C. Symptomatic treatment. Acute bronchitis is usually viral. Which symptom is most concerning for lung cancer in a smoker? Hemoptysis or coughing up blood is a red flag for malignancy. Which of these is an obstructive lung disease? The answer is asthma. Asthma is characterized by reversible airway obstruction. Which flu vaccine is preferred for adults 65 plus? High-dose or adjuvanted vaccines are designed for a stronger immune response in older adults. A 55-year-old snores and stops breathing at night. What symptom suggests OSA? Excessive daytime sleepiness is a hallmark of obstructive sleep apnea. Who's at highest risk for pulmonary embolism? Young runner, smoker on OCPs, or elderly post-hip surgery? The answer is elderly post-hip surgery. Immobility and surgery are major risk factors. 50-year-old non-smoker with a 3-month dry cough and normal X-ray. Most common causes are postnasal drip, asthma, and GERD. These account for most chronic coughs in non-smokers. Teaching MDI use: what's critical? Shake inhaler, inhale slowly, hold breath. All of the above, correct. Proper technique ensures medication delivery. Large unilateral pleural effusion, most likely transudative cause: malignancy, pneumonia, CHF, or PE? The answer, CHF, increased hydrostatic pressure causes transudative effusions. Progressive dyspnea, dry cough, and fine bibacillar crackles most likely indicate interstitial lung disease. Velcro-like crackles are classic. In COPD, long-term oxygen is indicated when SaO2 is 88%. This improves survival. Who should be screened for alpha-1 antitrypsin deficiency? Elderly with late-onset asthma or a 40-year-old non-smoker with emphysema? Suspect early onset or non-smoker cases. What's the most characteristic feature of bronchiectasis? Acute wheezing or chronic cough with purulent sputum? The answer is chronic cough with purulent sputum. Key CT findings in idiopathic pulmonary fibrosis: honeycombing, hallmark of advanced fibrosis. First-line outpatient CAP treatment for healthy 60-year-olds. Levofloxacin, azithromycin, doxycycline, ceftriaxone, or vancomycin. Azithromycin or doxycycline, macrolide or tetracycline monotherapy. Highest aspiration pneumonia risk: GERD, CKD, dysphagia, or diabetes? Dysphagia is the answer. Impaired swallowing increases risk. A 35-year-old African-American woman presents with a dry cough. Bilateral hilar lymphadenopathy, most likely TB, lymphoma, sarcoidosis, or fungal infection. Sarcoidosis. Classic radiographic features. 65-year-old smoker with new hemoptysis, normal X-ray. Next step, chest CT is needed to rule out malignancy or bronchiectasis. Blunted costophrenic angle on chest X-ray indicates pleural effusion. Fluid collects in the costophrenic angle. Echocardiogram finding most suggestive of pulmonary hypertension. LV hypertrophy, mitral valve prolapse, aortic stenosis, or elevated RV systolic pressure? Elevated right ventricular systolic pressure is the answer. Using the 5 A's model for smoking cessation, what's the first step? Is it advise, assess, ask, or assist? Common GI manifestations in adults with cystic fibrosis include peptic ulcer, pancreatic insufficiency, and celiac. Retired construction worker, pleural plaques, interstitial fibrosis, most likely, silicosis, asbestosis, coal workers' pneumoconiosis, or byssinosis. The answer is asbestosis. History and imaging are key. Severe asthma exacerbation, PACO 255mm indicates bronchodilator response, hypoxemic failure, or hypercapnic failure. The answer, hypercapnic respiratory failure. Rising CO2 signals muscle fatigue. Hallmark chest X-ray feature of ARDS. Unilateral infiltrate, bilateral diffuse infiltrates, large effusions, or a solitary nodule. Bilateral diffuse alveolar infiltrates, classic whiteout. PFTs show FEV1/FVC 0.7, significant improvement after bronchodilator, most consistent with asthma, emphysema, fibrosis, or chronic bronchitis. The answer is asthma. Reversible obstruction is key. What most reliably differentiates pneumonia from acute bronchitis? Sputum, cough severity, or focal lung findings? Focal findings on auscultation. Crackles or egophony suggest pneumonia. An alcoholic with poor dentition develops a lung abscess. Most common organism? Anaerobes, often from aspiration. Tall, thin 22-year-old male, sudden pleuritic chest pain, diminished breath sounds. Diagnosis: spontaneous pneumothorax. The answer is spontaneous pneumothorax, classic presentation. End-stage COPD, ABGPH 7.30, PACO 260, HCO 330. Diagnosis: compensated respiratory acidosis, chronic CO2 retention with renal compensation. Digital clubbing is most associated with which respiratory conditions? Asthma, acute bronchitis, or chronic lung malignancy, or OSA? The answer is chronic lung malignancy. Think lung cancer. Long-term consequence of chronic hypoxemia in severe COPD? The answer is polycythemia. Chronic low O2 stimulates RBC production. What's the primary goal of pulmonary rehab in COPD? Is it to reverse lung damage, cure the disease, or improve exercise tolerance and quality of life? After severe COVID-19 pneumonia, which long-term complication is most likely? Asthma, pulmonary fibrosis, or pneumothorax? Pulmonary fibrosis is the answer. Scarring from inflammation and ARDS. That's a wrap on our 40-question respiratory challenge. Tally your score, review missed questions, and focus on understanding why. Keep practicing. Every review brings you closer to success. If helpful, hit like and subscribe for more AGP CNP prep. Thanks for studying with me. See you in the next